Binge eating disorder. Binge eating disorder is the most common eating disorder that healthcare providers diagnose, although many people don't realize it's a disorder. It causes frequent episodes of binge eating. Eating an unusually large quantity of food in one session and feeling unable to stop. What are the signs and symptoms of binge eating disorder? Signs and symptoms of binge eating disorder may include eating past the point of satisfaction and to the point of discomfort. Eating too fast to notice how much you're eating or how it feels. Eating large amounts of food when you're not hungry or after recently finishing a meal. Eating in response to emotional stress, emotional eating. Eating alone and in secret and avoiding social eating. Organizing your schedule around binge eating sessions. Hoarding and stashing food in hidden places to access later. Hiding eating from others because you're embarrassed about how much you're eating. Obsessive thinking about food and specific food cravings. Frequent dieting, which may cause weight fluctuations or no weight loss. Guilt, remorse, shame and self-esteem issues related to binge eating. What causes the urge to binge eat? Many factors influence eating behavior, including psychology, biology and learned habits. What triggers you to binge eat might be different from what triggers the next person. Eating can release pleasure hormones in your brain, serotonin and dopamine, which might encourage addictive tendencies. Eating can also be a way of escaping or numbing uncomfortable feelings or compensating for unmet needs. Binge eating disorder recovery. Recovery from binge eating disorder can be an uncertain process. Maybe you worry that you are moving too fast or not making enough progress. The good news is you are taking steps to recover. 10 essential parts of recovery. As you go through the 5 stages of change and recovery, remember these 10 important parts. 1. Recovery is in your hands. 1. You will decide when to get treated and seek out the people who can help you succeed. 2. You'll get the most out of treatment if you tailor it to your needs and strengths. 3. You are in control, and you can ask for whatever you need to help you through this process. 4. Recovery isn't just about eating. 4. It should involve all aspects of your life including your family, friends, job, education, and spirituality. 5. Your treatment won't always move forward in a straight line. 5. Sometimes you may take a few steps backward. 5. Only when you realize that you can change for the better will you start to move forward and keep moving in that direction. 6. Recognize your strengths and talents. 6. Nurture your hobbies. 6. They'll help you build the friendships that will see you through this time of change. 7. Share what you've learned, and learn from others who are also coping with an eating disorder. 8. Accept yourself for who you are, and believe that you can get over your eating disorder. 9. Take responsibility for your own wellness. 9. Learn coping skills and other methods to ensure that you stay healthy. 10. Have hope. 10. Know that you can get better. 10. Your family and friends will be there to keep you motivated. The basic stages of recovery from addictive behaviors are the same for everyone. Researchers call this stages of change. It's 5 specific actions that people go through when recovering from problem behaviors such as binging. Understanding them can give you motivation and direction as you get better. Here's a look at each stage and what you can do right now to help you recover. What is the difference between bulimia nervosa versus binge eating disorder? Unlike bulimia nervosa, binge eating disorder doesn't involve purging calories, such as forced vomiting, abusing laxatives, or exercising excessively after eating. A binge eating episode ends with eating. On the other hand, Some people with binge eating disorder are chronic dieters. They may attempt to restrict calories before lapsing into binge eating, or they may attempt to diet after a binge to make up for it. If you are new at our channel, please subscribe our channel. It will be great support for us.